Do a dual plane technique for her under eye area. This is the albumin mixed with the plasma, and then this is just the plasma. This is going to go deep. You can put it under the muscle, but I usually put it right above the muscle deep, and then this goes superficial, so we get that dual plane. You can't put the PRF gel as close subdermally because you'll be able to see the lumps and bumps. So to get maximum collagen stimulation, we have this deep and then this superficial. So we're gonna go in with our cannula perpendicular to the tissue. Sorry, you might hear a little pop. And then we're gonna flatten our angle of our syringe and we're just gonna twist. Twist, twist, twist. You'll feel some resistance and you just wanna be real gentle. There we go, we're getting a little further. Okay, we can see we're deep because it's lifting up the whole cheek. And then we're going to press. Sometimes they'll feel a little sting because the pH of the blood is low, so it makes it a little bit acidic. How you doing? You doing okay?
Yeah, I don't feel anything.
She's very tough. We're getting a little bit closer up here. How many days are you out from yours now?
A week.
A week? Lift your head up and show the, so that's a week out from PRF. You can see she still has a little bruise under her left eye. Okay, I'm a little bit further up right here. Weird noises. Okay, all the way up in the trough here. Perfect. You want to slightly overfill, and by slightly I mean like 5 or 10%. If you overfill too much, they're gonna have a lot of swelling and they'll be scared to do it again, and you can overstretch the tissue. So I just slightly overfill. And we're gonna put a little bit in the medial cheek, just like that. I'm gonna get her lateral trough as well. Okay, other side. After I do one side, I like to mix it back up because you can see how it started to separate a teeny bit at the top. So we're just gonna mix it a couple more times. I do that with Sculptra as well. Whenever you're injecting Sculptra, you wanna shake it throughout your treatment.
So you got what done? You got some
She had it done a week ago. Okay, this is our starter. I'm gonna go perpendicular. I'm gonna go perpendicular and get a little deeper, flatten our syringe, and just gently roll. If you get stuck, sometimes what helps is I'll push a little bit of product. That's true with filler or PRF gel, and it creates a space in the tissue, and then you can get it to go a little further. How you doing?
Good.
So you can go all the way in and then retrograde out, but I tend to kind of create space, so I'll go like a couple of millimeters and lay some product as I go up. So I'm gonna lay a little bit of product right there. Makes it a little more comfortable. And then I ask the patients to not massage their face for at least a week, and we tell them not to exercise for a couple of days. No hot or cold compresses because it'll damage the growth factors. Okay, we're going to the lateral. She looks so cute today.
Celebrate your festivals and feast, and you're supposed to like do all the things lavishly before you were to give up anything for Ash Wednesday.
Oh.
And then that's what kicks off Lent, and then Lent ends on Easter Sunday.
You know, most people don't know that Mardi Gras is like
I didn't know that.
it's like a religious holiday. It's kind of like a Christian holiday.
So this is going back superficially. Sometimes what I'll do is I'll just go in with a needle right there, just to make it, if the patient's uncomfortable, because this can be a teeny bit more uncomfortable. That's what we did with Heather. That's why she has that little baby bruise right there. Just putting it.
How bad did you bruise the first, like, initially?
The
really more
first
than that.
time we did it, I didn't bruise at all. I just had really bad swelling.
Yeah.
And then this time, I didn't have swelling. I just had one little dot bruise. That was it.
Oh, wow.
The first time, no bruising. Literally, it was just swelling. So you might swell a lot this time.
Okay. How long does that last?
Usually 2 or 3 days.
Okay.
Yeah. It didn't really start swelling. Well, the next morning. So I guess tomorrow morning, whenever I woke up, my eyes were like swollen shut almost.
Okay.
But then
Well, good to
obviously
know,
it
because
goes
I
down.
would have been like, what?
Yeah, and then I would say the
And since
second
you're more of
day-
a rashy person, you're more likely to
Yeah.
have a histamine response.
and then the second day was worse, swelling wise,
Okay.
and then it started going down.
I hope I'm not rubbing on your burn too bad. I'm trying.
Yes. Okay.